Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're talking about psychiatric medication and the information and stories that don't often get told about the concerning impact of these drugs on some children and adults. Before we go any further, I want to be clear that this is not an anti-medication or anti-psychiatry show. If you follow my work, you know I take a very balanced approach to this issue and believe that these medications can have their place in the treatment toolbox for a minority of people with mental health symptoms. However, it is my strong research-based opinion that these drugs are widely overprescribed and under-researched, especially when we're talking about children and teens. I see kids and adults daily in my clinic who have experienced severe debilitating side effects from these medications. And everywhere they turn, the answer from the traditional medical and mental health world is to simply stay on them or take more. This is really unacceptable when we now know that these drugs don't help the majority of people stay symptom-free in the long term, and they can cause temporary or permanent problems. True informed consent is necessary when discussing the use of these medications. That requires a full discussion and disclosure of potential benefits and risks. This typically doesn't happen, and I see many parents who end up very dismayed at the side effects and sometimes the worse symptoms that can result from using these drugs. Wherever you stand on the issue of medication and whatever your personal experience has been, my goal with this episode is to help shine a light on the parts of the psychiatric drug story that are often hidden so you can make the best decisions for yourselves and your children. To explore this with us today, I've invited Lynn Cunningham on the show. Lynn is an award-winning filmmaker, co-director and producer of the documentary film Medicating Normal, and produced, directed, and edited films and TV for PBS and the History Channel in the 1980s and 90s. A personal experience with a family member diagnosed with serious mental illness and medicated to the point of being unrecognizable led Lynn to research the world of mental health treatment and how what we're told about psychiatric medication is far from the whole story. She's interviewed hundreds of psychiatric patients and consulted with scores of experts across the country about their experiences in order to create Medicating Normal. This film is a stunning new perspective on the safety and efficacy of psychiatric drugs and society's over-reliance on them to relieve pain and suffering. Lynn, it's such a pleasure to have you with us today. Welcome to the show.
Thank you so much, Nicole. Thank you for having us.
This is such an important topic, and it's one that I don't think gets enough attention, certainly not enough mainstream coverage, whether we're talking about in, the typical media channels or even in the realm of traditional medical and mental health care. It's something I've been advocating and educating around for 2 decades now. And so I'm really, really pleased to have you here to share your experience of making this film and really to let people know about the film for their own education. I want to start by having you share the story of how you became interested in this, because like so many of us, we come to this topic from either an experience ourselves or with a family member or something that has happened in our lives. And so tell us the story of how psychiatric drugs came on your radar and why you're so passionate about this.
I had a family member, very high functioning, scholar, athlete, Ivy League educated, high power job in her 20s, who started to unravel. She might have had some trauma. It's unclear what started the whole thing, but in her 20s had symptoms of depression first, and they morphed into later psychosis, and all of a sudden she is being diagnosed with a very serious schizophrenia. Mm-hmm. And I couldn't figure out at the time. Our family look to all the top experts, the psychiatrists in New York and on the East Coast, Boston, New York, Washington. And she started to see the very top experts. and was medicated pretty quickly. I think started on antidepressants, and then it evolved. And by the time about 10 years into this, we were told this is a chemical imbalance, and we will be able to manage it effectively with education. I mean, with medication, and it is a lifetime disease that she has, but she's going to be okay. And one drug led to another, and what ended up happening, yes, a little bit of stability occurred, but 10 years into it, she was on, starting with one drug, she was on 10 drugs. And I just didn't get, and calling me up every day, Lenny, is everything going to be okay? Well, when you're asked if everything's going to be okay by someone you love, you assume that it means, am I going to be, are you guys going to take care of me? But one clue led to another, and I realized she wasn't really asking that. She knew we have a very tight, loving family, and she was always going to be okay. But she was on disability. She was dysfunctional. Her asking that question was, am I going to reach my potential as a human being? Because Nicole, she was really doped up. Her eyes were fluttering at half mast. The weight gain was enormous. The really wanting so badly to be keeping up with her elite college buddies, but unable even to have simple jobs like at a bookstore or at a grocery store. And the decline was so shocking to me that I thought, okay, I'm going to answer honestly, and I am going to look into what it is she's putting into her body on a daily basis. And that led me to reading Robert Whitaker's Anatomy of an Epidemic, which, had I not had someone I loved going through this, it would have been in another sphere, would have been in the mental health sphere, and I would have respected the mainstream. I wouldn't have probed at it, but I saw someone who had such great potential not realizing it and really suffering. So that inspired me to read it, and that one book led to so many well-written books, and I know you know all of them. They're featured a lot on Mad in America. Dr. Bregan, many, Dr. Healy. So I read and educated myself, and very soon thereafter thought, this is not a story. This data and this information about these drugs is not what we're told in mainstream media or in mainstream medicine. And while there are many people, I am sure, who do well on psychiatric drugs, I know that because they have spoken to me, there are as many, if not more, who do worse. And that's the story that nobody knows about. And so as you say, as you are not, I am not anti-medication. I am pro-informed consent about this, which means showing the film and getting it out there.
Yeah, it's a powerful story. And I know so many people listening can relate to that, either for themselves, their child, a family member, someone they know about. This experience of getting diagnosed with something, well, first starting to have some symptoms, getting a clinical diagnosis, and then before you know it, ending up on, what I call this roller coaster of medication treatment, that it's a very slippery slope. I mean, most parents who bring their children to our clinic, the vast majority of kids are medicated or have been medicated, and they tell a very similar story about how, it started with a recommendation for one medication. And I thought, okay, this is a well-respected, physician or prescriber telling me to do this. This will fix the problem. And then before they knew it, their child was on, multiple drugs, changing doses, and their kid was a shell of their former selves, is how a lot of people will put it. I don't know where my kid went. And what started with maybe one type of issue now has, ballooned into several different types of issues. And so there's a lot of people who can relate to this. And I think, I wonder if in your situation with your family member, because I see this a lot, and I hear this story a lot, what happens when someone isn't doing well is it gets blamed on the diagnosis itself. Well, you have to understand, you have this, you're coming in, okay, well, your symptoms are getting worse. Well, actually you have, this additional diagnosis or these 3 other diagnoses that we didn't know about initially. Everything gets put on the diagnosis or the person. Very rarely does anybody step back and go, I wonder if it's the medication we started that could be worsening things or creating problems. And it's like this light bulb moment when I point that out to a lot of people, like, hey, has anybody helped you consider whether the worsening of your symptoms, the additional symptoms you developed, the rapid deterioration may have had anything to do with the drug itself? That's just not something most people even consider or are told.
Yeah, and that I don't understand at all. That is the key to the entire thing. That and also withdrawal, which manifests itself if you do not taper any of these medications slowly, much slower than what they recommend generally. And in the making of the film, it struck us hugely that one doctor on the West Coast would say, oh, cut a pill a third, in a matter of 3 weeks or a month. Another doctor would say, oh, cut it, skip it, take it, skip it 1 day. I mean, the variation of tapering instructions is I mean, that the FDA doesn't see that and flag it, I don't get it. And the fact that any of these drugs cause withdrawal for many people, it would be, well, the withdrawal brings up symptoms that look like the original problem.
Right. Yeah.
So you can see why they're adding on diagnoses. If you don't really understand withdrawal, you're going to add on a diagnosis.
Yeah, well, that's right. And people get stuck in the trap then of the medications aren't helping them, but they also aren't able to get off of them. And that feels so disempowering and so frustrating because that's a common story and experience that families share as well around the withdrawal. Well, the doctor started my child on this medication. They weren't doing well on it. So, they took them off over the course of a week or 2 weeks or whatever, started them on another one at the same time. And I'm going, whoa, wait a second. First of all, you didn't even give the child's system a chance to rebound, to gently and appropriately come off of that. And then you started another one. It's no wonder people struggle with this. It's no wonder we see increased problems. And yet 9.9 times out of 10, the explanation that's given to people around why the symptoms are worsening, why the problems are worsening is that, well, you have mental illness and it's getting worse. And it's not even looked at that, let's consider what other factors here. And you're right. It's astonishing, that we don't focus on that piece more. We have the research evidence for it now. And to your point about the withdrawing protocols, I find it fascinating. That's a nice way of saying I find it, I'm a bit incredulous around it, that people who are trained to prescribe these meds do not receive specific detailed training about how to get them off of it. In fact, we have very little research substantiating any protocols for taking people off of it. And I think that's a piece of informed consent most people aren't aware of, right? Hey, these people know how to put you on medications, but if you need to or want to get off, there's going to be a problem there, right?
Yeah. And then the tapering, if you go into any of the drugs, if you type in Zoloft support group, they all share very valuable information. I mean, it's a subculture that every prescribing doctor should delve into and start to read before they prescribe any drug, because the people who are wrestling with the agony of some of this. I mean, sometimes it's not always agony, but for many people it is. And really valuable resources, advice are shared amongst these support groups, and to a very sophisticated degree. For instance, the notion of hyperbolic tapering is very sophisticated. Why is it on an internet support group and not in a university medical school course? So,
well, let's back up and talk about why. Let's back up and talk about the bigger picture of why this stuff isn't part of the mainstream education and dialogue in the media, in medical education, in the fields of medicine and mental health, because this really gets to why these drugs have become so prevalent, why the stories that we're told are the stories that we're told, and why information about how to get off of these drugs is not, a part of what happens in medicine and mental health. So talk about what you discovered around that in your research for the film.
So it's a profit-driven system, and there is nothing wrong with that. There are many of those in our society. But when the profits, when the regulators who are and the testers, the people who fund the drug trials, are the same people who make the profit off of what they are, the trial they are testing, it just is a conflict of interest from the get-go. So it is just a very simple explanation. A lot of money is poured into drug trials, and it has to be if a drug is going to be safe for the public. But I just believe that the people who test these drugs need to be separate from the people who are making money off of these drugs. And that is so simple, and I don't know how we're going to do that as a society, because this is it's a systemic problem. But that's it. It's our profit-driven system, I think.
Yeah, and I think most people don't realize that the vast majority of the research and the data that we have on these drugs comes from trials that were done by the manufacturing companies themselves.
Yes.
And I think when people are made aware of that, they go, oh, well, okay, inherently there is a conflict of interest there. But people aren't aware of that the vast majority of studies are done by the companies who stand to profit from them. And in fact, we've had research come out in recent years showing that data is hidden, suppressed, that the way that data is analyzed is often to show better efficacy and safety than the trial actually produced, that there's all kinds of manipulation within, quote unquote, the science behind these drugs. And yet, in the fields of medicine and mental health, we just continue on as if none of that's happening, right? Nothing to see here, not a concern. This is what you need to be doing. And that disconnect to me is profound.
Yeah. And in the film, we go into something so simple as when you say manipulation, there is Bob Whitaker talks about one of the early Xanax trials. Xanax is a benzodiazepine. It's used for anxiety or sleep. I mean, it's very, very effective. As one of the film's characters says, it works immediately.
Yep.
It's extremely dependency causing, and down the road causes lots of issues. But in this trial, to speak to what you call manipulation, the trial went on, and in the first 4 weeks, Xanax compared to placebo was doing so much better. And but by 8 weeks in the trial, the placebo started doing so much better. And what did they? And then when you get to 12 and 14 weeks, so much the Xanax plummeted in its in fact, it started creating panic attacks. But what is chosen by the communicators and what's published in our journals is the very small window of when Xanax actually did well. But that does not help our public who are thinking about, should I be taking Xanax?
That's right.
So that's an example of what's communicated.
And there's so many examples of that. I mean, I think even about stimulant medication trials, stimulants, which are touted as the gold standard, first line or second line treatment for kids and adults with ADHD. And yet, when you look at the data on stimulants in the short term, it looks very compelling. Wow, symptoms go down, kids do better. However, the people who have taken the time to do the long-term research on that, which have not been the pharmaceutical companies, by the way, the long-term research shows that, 18 months to 3 years down the line, suddenly you see no difference between the level of symptomology and the functioning between kids who are taking the stimulants and kids who aren't. And it's that type of longer term research, especially when we're talking about kids and developing brains and bodies, that we need more of. And I think, parents especially are surprised to hear that we don't have those kinds of longer term studies, that, on average, the studies supporting the use of these drugs in children and adults are, somewhere between 4 and 12 weeks. Yeah. And that we don't have long-term safety and efficacy data on lots of them, that there is this massive, manipulation of study protocols and data to show a positive result, and that a lot of the side effect pieces get hidden, either because we're not running the trials long enough, or they conveniently find ways to put that under the heading of things that would have happened anyway, because these are people who have mental illness or, neurodevelopmental disorders. Like, there's all kinds of sort of magic going on behind the scenes that keeps people from knowing all of the facts about this stuff, right? Which is what you and I are so passionate about. Let's just put all the information out there and let people decide.
Yeah. Yeah. And I don't blame parents. I don't blame parents for wanting so much to help their child in this crazy world. And in my opinion, this crazy educational system that's so competitive and so based on just not even, getting into what school for what reason. And I don't blame them for, and I've heard it many, many times anecdotally, these meds help because I see my child's they're doing better in school. And then I see my child's confidence go up. That's incredible. But is it really happening that way? And again, it's all anecdotal, but, in my family also, I have a dear nephew who was put on these meds, and he's now college age, and he's now aware, looking back on how early, 3rd grade, how yes, when he took them, he could get buckled down on the homework, but he ended up becoming a musician, and he's in music school now. What happened? He didn't do his music. So there he was, buckling down to do the homework, but completely ignored the creative side of himself that actually was what he wanted to pursue in life. And I don't think that's helping him. And he's also telling me all about his fellow students now. So many in college are medicated. I mean, it's more than not. We're looking at chemically adapting our children to a life that we've created that's crazy. It just, to me, it's Alice in Wonderland.
Well, and I think that's the point that Robert Whitaker makes. And by the way, for those of you listening, if you have not heard the episode that I did on the podcast with Robert Whitaker a couple of years ago now, I encourage you to go back and listen to that. It dovetails really well with this conversation. But I think one of the points that he really makes is about this epidemic of prescribing medications for things that get labeled as chemical imbalances, or this is a problem within you as the individual, when actually most of the problems that people are having are indicative of trying to survive and adapt and be functional in a culture, in a society, in an environment that has become increasingly unhealthy. And yet this idea, this messaging around, no, if there's symptoms of inattention, hyperactivity, anxiety, mood issues, whatever, that is a chemical imbalance. That is a you problem. That message, and I'll call it a myth because it is now clearly a myth based on the research, that continues to come out. That messaging has perpetuated, hasn't it? And that's part of what's been so compelling for the medical and mental health communities to jump on this train, as well as people in general. I mean, we could probably go outside right now and just 10 people on the street and ask them, the chemical imbalance myth has become widely accepted, and yet it's not accurate. I'm curious in your, work with the film and in your research, what your take is around that.
Well, in the film, I think we actually have a clip of Bob saying the chemical imbalance theory of mental illness is not true. It never was.
Mm-hmm.
And what you do hear about the chemical imbalance theory, many top level academic psychiatrists say, oh, well, we knew that it wasn't a real thing.
Right.
A long time ago, we knew. But it doesn't take away from what you just said. Whether we know it or not, it's used constantly as a rationale for medicating. Right. And I think it was one of medicating normal film screenings where a very well-meaning doctor stood up and said, look, we need a simple rationale to help people understand why they need these meds. It's a simple rationale, meaning patients who come in aren't sophisticated enough to really understand what's happening, and they need to know why this medicine will help them. Well, the medicine, if you look at Joanna Moncrief's work, it does impact symptoms. There are impacts of these medicines that for a short time can be desirable or helpful, but to look at it that way is a much better, simple way of looking at it, rather than you are a mentally ill person with this diagnosis, and therefore for a lifetime you need to be taking an antidepressant every single day. There's a huge difference between understanding that maybe an antidepressant for 6 months to help you, if it helps you to get, if it's the only drug you're on and you don't go into a drug cocktail, to get from being unable to voice your problem to going to a therapist, if that helps you, that serves a purpose. And that is a drug-centered way of looking at it versus the disease model way, which I'm sure you've talked about, Nicole.
Yeah. And, it's so interesting that physician said, essentially patients aren't sophisticated enough to understand. We need a simple thing for them to understand. I would argue exactly the opposite, that medical professionals truly don't receive an education and understanding of what's happening, and that they, in fact, are the ones who need and benefit from having a very simple disease drug model of explaining and understanding these things, because actually that's what the field of allopathic medicine is based on, right? When we look at, forget about mental health, when we look at the medical system, it is based on a set of symptoms that we give a diagnostic code to, and that diagnosis then determines the specific treatment, which is very handy and clear cut for something like a broken leg, an aneurysm in your brain, type 2 diabetes, whatever, where it's a clear-cut set of symptoms. Here's the name for that, and here's the treatment that we give to that. The problem is that model falls apart when we look at mental health, because there are so many other factors that influence how our brains function, how we feel, what we call mental health or mental illness. So I would argue that actually that simplistic explanation of here's your diagnosis and here's the very simple, genetic problem, you have a chemical imbalance, you need the pill, that serves the purpose of our commercial medical system, where we have 8 to 10 minute office visits. And really our providers are in the role of giving things a name and then giving you, a pill to deal with that, which all sounds very good, except that it doesn't work.
Yeah.
I wish it did. I tell people all the time, I'm like, I wish that there was a pill I could give you or your child to just make these things go away. Believe me, I would be the first to sign up for that. I mean, my training was very traditional. My doctoral training in clinical psychology was traditional training. I mean, we were taught you do therapy, and then very often you refer people for medication. And the gold standard is the combination of some type of psychotherapy, psychological intervention with medication. And I bought into that and thought, oh, that's the standard of care. And I did that until I discovered it actually wasn't really helping people. And I think for me, and I want to hear some of the stories that you put forward in the film, But for me, the real turning point was when I had this realization that I was seeing more and more kids on more and more drugs, and they were doing worse and worse. And it hit me one day like, wait a minute, something is way off here. I'm seeing more kids on more drugs that are supposedly correcting their chemical imbalances and helping them, and yet I'm watching them deteriorate further. And for me, that was the pivot point of looking into what was really going on and opening my eyes to the fact that there was more to this story than what I had been taught. And I'm curious in the film, because you include a lot of patients as well as experts. What were some of the stories? Like, what do you think are some of the most compelling things that people shared, maybe from their own experience as a patient or having a family member as a patient around all of this?
Well, I would say almost every single subject in the film began to do worse on their medication, and they knew it. And they knew it. They would report to their doctor. Their doctors, for the most part, did not accept it or believe it. And that's a big thing when you're coming in and trying to explain that you don't feel good or something's off. I think it's going to be a shift. I think doctors of the future, and if our medical schools can start to get all this into it, doctors of the future, it's going to be more of a partnership. All of our subjects were alone. They weren't believed by their doctors. They weren't believed by their family. In Dave's case, in the film, we don't really go into it, but he didn't talk to his marriage broke up because his wife was saying, why aren't you just taking your meds? He was saying, I don't feel good on them, and they're making me worse. I'm losing my memory. I don't know who I am. I'm a shell of my former self. So this very isolating experience of having absolutely nobody believe you, and that think of veterans in general who come back very traumatized from the wars they've been in, and they too are then turned into mental patients who are on all these meds. And isolation, I think, is the biggest thing, and the suffering and the inability to know how to get out of a situation, because there's dependency. There's such dependency, and the agonizing of getting off of the meds and going too quickly. So that's one thing. Another thing with we have two amazing parents of our subject, Rebecca, who was a young girl. She wasn't put on ADHD meds. She was struggling with an eating disorder, and her parents went in first thinking, well, she was going to have therapy. And that therapy, the therapist right away said, well, let's kickstart your therapy, Rebecca's therapy, with a drug. And that is really perplexed the parents, because they did not intend to go right into drug therapy. They wanted therapy first. Right. So that whole experience of that wonderful parent couple, they had a year of thinking that their daughter, who was increasingly medicated, they had a year thinking that they had lost her completely. And it wasn't until they followed their instinct of knowing, this is who my daughter is, and this medication has turned her into someone else. They had to fight the system. I mean, really go against the system. And that is a scary thing. When suicidal ideation is involved, for you to stand up to a doctor who's saying, I wouldn't do that. I wouldn't do that, parents. You're going to be irresponsible. So that this notion of, they educated themselves. They read all the books that we've talked about, Anatomy of an Epidemic. If you go on the medicatingnormal.com website, we list all of these books, and Mad in America, where you're featured. So this couple, unlike many, I'm not saying that. I think many parents are willing to do the hard work. They did the hard work. They made the hard, scary decision to take their daughter off of the medication. And what happened? She normalized. I mean, her problems, I don't want to say it's magic and her problems went away. She still needed to do a lot of work. but she wasn't psychotic. She wasn't suicidal. She wasn't going to be in their basement for the rest of her lives. So that's what we tried to show with the film, that, you know, problems don't go away when you get off of medication. They just, in a way, you're more able to deal with them.
That's right. Yeah. Your brain is actually able to make use of the cognitive behavior therapy, the whatever psychotherapy, whatever it is that needs to happen. I think most people don't realize how impairing these medications can be until you've experienced it yourself or seen it in a loved one. You know, I've had parents come in and say, this is not my child. My child's like inner self is gone. They're like looking through me. They don't have the personality they had. They can't even like follow basic directions and do basic things. And, you know, I'm thinking about a story. This was several years ago now, but you reminded me of this couple who had a child who had been diagnosed. She was a young teen who had been diagnosed with several types of things: eating disorder, severe anxiety and panic, depression. These kids end up with the whole mix of things, as do many adults. Especially if they're not getting better, right? Then then more diagnoses is better. Clearly, we didn't give you enough names for your problem. So she had been diagnosed with lots of things, was on lots of medications, and it was clear to the father that she was not doing well, that actually these were creating problems, that what they had been dealing with before was bad, but this was even worse. And mom was so hesitant. No, these are, you know, that we need to do what the doctors say, whatever. And it's interesting what happened. The mom ended up having so much stress and anxiety and struggle herself. She ended up placed on psychiatric medication for her issues and experienced for herself the cognitive impairment that went along with that, the worsening of several of her emotional issues, that feeling of just sort of being numb. And it was over the course of a few months then that she started to go, aha. And I remember her sitting in my office crying, saying, I get now what this has done to my daughter. I had no idea how impaired I would feel. You know, she would talk about, I'm just foggy. Like, I can't think through things. Like, and then this was an intelligent, like well-functioning person. She's like, I can't even, you know, think through how to structure my day. And her experiencing it herself gave her insight and understanding into what had been going on with her child and what her child had been experiencing. And of course, that led to a shift. Then not only did mom, you know, work on careful tapering and getting herself off of them and getting herself the therapy she actually needed, but also in supporting the daughter with that. But I think, you know, it's easy to look at these things and say, as you mentioned, you know, you're making it up. Well, you know, you have mental health issues to begin with. This is all in your head. You know, you just need to stay on your meds. And it's a whole different thing to be in the shoes of the person experiencing the very real changes. And we have to recognize and respect that each individual is going to have their own experience with these things. And it may not be what I would have or you would have, or even the majority of people would have, but we're all individuals and can have individual responses to this stuff.
Yeah. Oh, absolutely. That is such a fascinating story and how are they doing now?
They're doing very well, very well. That was, you know, a big shift. Mom got the help she needed. They got the family help that they needed. We were able to make progress with their daughter. You know, what often happens because of the nature of my clinic and the severity of and complexity of people that we see, unfortunately, we tend to be the stop on the journey once people have done the things they've been told to do. And so it's very often the case that we don't have the opportunity right at the beginning of treatment to say, okay, here's what all your options are, but here's where we're going to start. And this is why. And really using a medication as a last resort approach. Typically, by the time families get to us, it's because they've done all of those things and now their child is on a cocktail of drug, you know, there's more severe issues. And so we have to unwind that and then help them do the things that someone should have done right from the get-go. But unfortunately, medication, even though for many things in child and adolescent medicine, psychiatric medication should not be the first line treatment. very often it is. And the excuse that's used is, well, parents just want a quick fix. Well, kids need to do well in school. Well, we're worried about, the increase in suicide and eating disorders. So let's intervene, with medication right out of the gate. To your point, parents bringing their kid in thinking we're going to get some therapy and instead being told to go on medication. I hear that all the time from parents. They had no intention. They didn't even know that was an option. They weren't seeking medication treatment, and yet they leave the office with either a prescription or a referral to a psychiatrist to get a prescription, and they just assume, oh, well, this is just how it's supposed to be, only to discover later on, right? And so, I wish that in the field of mental health, we would disentangle ourselves from this story about medication to do the good therapeutic, developmentally focused work that we're trained to do with kids, and to realize, and with adults, and to realize that that is the key to moving forward, whether or not someone ends up also benefiting from a small dose of a single medication in combination with that. You need to have a good therapeutic foundation. And it's so frustrating to me that that's not where the focus tends to be.
Oh, 100% agree. Really interesting. We've tried, the film is on PBS, which is wonderful, because I salute the PBS people for accepting, because it can be seen, if you're looking at it from a very mainstream medicine perspective, as a radical film. It isn't, because again, we've talked about our message really is not anti-medication. It's just inform yourself, really learn about what could happen. So the film is on PBS, and but we really want to get it into, and we have an educational distributor, and it ran for a while, and it is getting into universities and medical schools, but not at the rate I would want it to be. And I feel we've just got to get it in front of younger doctors in training. And I think that they're going to hopefully understand it earlier, because I think it's really hard when you have led a lifetime of prescribing, and you have seen maybe some people in your practice, especially if they keep coming back to you doing well, for you to change your ways. I mean, there are the doctors and psychiatrists in our film, in my opinion, are heroes. For instance, someone like Anna Lemke was prescribing left and right. And then she had the sort of humility as a doctor to look at what she was doing and say, wait a minute, I'm harming my patients. I'm going to change the way I prescribe. And she did. But there are many, many doctors out there that don't have that ability. But that humility as a doctor, or even Bob Whitaker, he was a standard medical writer, writing for the Boston Globe. And I think his aha moment came when he was trying to talk about the unethical practice of giving someone a placebo and not the real psychiatric drug. And he was looking into the unethical practice of that and wanted to write an article. And he looked in and he actually saw the placebo group was doing better than the people medicated. And, he was like, wow, that's interesting. And that set him off. So just, it's interesting, our society, how people, and your mom, the story you just told about your mom, is she had to experience and come face to face with something before she changed her mind about it.
That's right. Well, and to me, that's good journalism. That's good medicine, to stay curious enough and humble enough and aware enough to go, maybe I need to look deeper at this. Boy, what I'm doing, isn't getting the results that I thought. That's good medicine. That's good mental health. That's good journalism. That's good parenting. That's good, all of that. And yet there's that's right. It's good. Exactly. It's good science but boy, is that a discussion that's been blown wide out in the open lately, right? Around what do we mean when we say the science? And science is really about the ongoing discovery and humility and openness to the fact that there's always more to learn, and that we need to be willing to change our mind. And I think that's what's so challenging around this. I'm glad you brought up some of the experts, because I do want to point out that you have, a lot of firsthand accounts and patient stories woven into the film. You also have a wide variety of professional experts. And so I want people to know that, because there may be people listening who, I encourage everybody to watch the film for yourself, but there may be people listening who are like, boy, I think this might be helpful for me to bring to the awareness of my providers, of my child's therapist, whatever. And I just want to highlight that you have professionals in the film speaking to these issues.
Yes. Ellen Vora practices in New York City. Anna Lemke at Stanford. Peter Gocha. We have many. Maybe we have a pharmacist, Ivan. He's interesting. He runs a wonderful pharmacy on the Upper West Side of New York City. He says he says basically benzodiazepines should never be prescribed for more than two weeks, and it's on the label.
Right.
Something that's on the label.
Yep.
And yet he says people have doctors. He's quote, doctors have forgotten about this, and benzodiazepines are mostly taken every day by people who take them.
Yeah. I've had children in my practice who have been prescribed benzodiazepines 3 times a day, every day for years. Right. It's astonishing when you look at even what the recommendations and what the approved dosing is for these things. Yeah. It's unbelievable.
Yeah. So back to Ivan, he, as a pharmacist, he says, okay, my advice, this was not in the film, but my advice to anyone taking any of these meds is keep a little journal. Write down, what you feel and when, and if you go back to your psychiatrist or your GP and you have taken accurate notes about how you feel and when, you're armed with information that will help convey the reality of your situation, versus if you just go in and say, something's not right, I don't like this, that's hard. That's hard for a doctor to handle that, but very accurate feedback. Anyway, I feel as a society that it is opening up, that Mad in America has been huge. Bob Whitaker is an amazing, he has changed, he needs an award on a big scale, in my opinion. And, people going to Mad in America, he is as critical about alternative treatments as he is about a medication. He's very fair in his critical look at these. And
absolutely.
What exists now on the internet, when we started our research, nothing existed, nothing negative about any psychiatric drug, especially stimulants.
Right. That's right.
And now it's beginning to come out, and there is a change. We're in the midst of a change. I think the pandemic put fear into everybody, so I'm not sure. We're waiting to get through that, but
yeah, I think the conversation is shifting as more people have access to more of this information, these stories. What's the one big thing that you want people to take away from the documentary? You created this, you poured your heart and soul into this project, you created this amazing film. There's so much great information in it, but what's the one thing that you really want people to take away from it?
I think it should be, and it's not just psychiatric well-being, it's take control of your own health. And that means really learn about it. Don't assume, and this is not to be disrespectful to doctors, but they are busy. And as the way we've set up our system, they don't have time to really know you. So it is your responsibility as a patient to either get who you are across to them, and wait. If it takes 5 sessions before you start a medication, take those 5 sessions to tell them who you are. And then if you can, read as much as you can and educate yourselves. That's my biggest.
Yeah. And the documentary certainly helps people get a jump start on educating themselves, understanding more of the issues involved. Let's tell people where they can how can they access the film? How can they get more information? You've put together a lot of resources for people who are interested in learning more on these topics or getting support for themselves or a family member. So where can people go?
It's simply the name of the film. It's medicatingnormal.com. And that is our website. And you will see on that website, there are many resources. These resources are very, very good. We should be putting more resources every day. It will show you our PBS broadcast schedule. It will show you the trailer for the film. We also have this very exciting aspect of our outreach, which is our community screenings. And we that's where we show a film in a particular region, and in that region we then have a panel discussion afterwards, which is in many ways so much more important than just watching the film. And people can see the film on Amazon, they can see it on Vimeo. It is available to stream, but if you really don't know about the topic, I encourage you to find out where you can see a community screening or plan one yourself. They are very informative, and they can be peopled with experts or with people with lived experience, so that, and then the audience participates, and what the audience brings to one of these events is as important as the film itself. So yeah, we've had almost more than 200 community screenings thus far. So
it's amazing. It's amazing. The film is amazing. The resources that you've put together on the website are a wonderful support. Lynn, thank you for all of the research and all the effort you put into creating this film, to get this message out there, to help educate and inform people. And thank you for being here today to talk with us about it. We appreciate you.
Oh, and thank you, Nicole, for having me.
And thanks as always to all of you for being here and for listening. We'll catch you back here next time.